This podcast is for informational purposes only and is not intended to replace professional medical advice or be a substitute for therapy. Please contact a mental health professional as needed. If you are in need of urgent or emergency health care, please contact your medical and/or mental health provider, call 911, or go to your nearest emergency room. The information presented in this podcast does not reflect the opinions of those with whom Dr. Ellick might be affiliated as an employee, consultant, or colleague, past or present. Hello and welcome to another episode of Mayhem to Mindset with Dr. Laura. I am your host, Dr. Laura Ellick. And with me today is a guest. I have to tell you, this is by far the best bio I have ever received from someone. So I may laugh along the way, not laughing at you because I think it's just so great. So here we go. This is Dr. Hector Rodriguez, a Miami-based psychiatrist with a camera in one hand and a supplement bottle in the other. Dr. Hector blends neuroscience, theology, and high-performance coaching into a signature style of care that's as soulful as it is science-backed. I'm sold already. He's redefining mental health for high achievers, Latina professionals, and anyone ready to heal deeply and live boldly. By day, he's decoding trauma and upgrading executive function with precision plans that balance meds, GABA, and gym reps. By night, he's building a personal brand that's part Amen Clinic, part Jiminy Cricket, and all heart. Whether he's leading a workshop on resilience, filming wellness content under a white butterfly banner, or writing empowering notes to his patients, he shows up with clarity, compassion, and creative fire. He's not just your psychiatrist, he's your mindset mentor, your mental fitness coach, and your quiet revolution in a world that needs more grounded brilliance. Okay, I need to just get up and leave right now. That was amazing. So thank you so much for being on the show today. I'm so happy to have you here. I can't even tell you.
Awesome. Thank you for having me.
So tell us a little bit about your background. You're now, tell us about the white butterfly. I see on camera there is a white butterfly behind you. This is obviously something that is incredibly meaningful to you.
Yeah. So my background kind of started being a photographer, believe it or not. I was a fashion photographer for about 8 years before I decided to go to medical school. And I remember during the photo shoots, I spent a lot of time with my patients, with my client that was about to shoot. So if we had like a model or even the client themselves, like I would spend time getting to know them, really to like have them connect with me, because during a photo shoot, they have to really have a good connection with you. So I remember I would do that a lot. And a lot of the models that I was working with had their struggles. Usually a lot of them went out the night before and they were kind of, recovering that
Not
morning.
Feeling the best. Yeah.
Exactly. So like I noticed that I did that a lot. And it came kind of natural. But when I started going to medical school, I was really intrigued by women's health. So for a long time, I was like, I think I'm going to go into OBGYN and just kind of focus on women's health and hormone therapy and all that stuff. But honestly, it was like the last rotation in med school that I encountered psychiatry. And I always thought psychiatry was just kind of like, this is not really for me. Like, the pharmacology part was so complex, at least in med school, that I was like, I am not going to go down that route. I think women's health is the way to go for me. But I really fell in love with psychiatry. And then I was able to kind of marry the two. So that was then. Flash forward. I'm in residency and I'm trying to figure out what I'm going to do after residency. Do I want to just get a job or do I want to do my own practice? I've always been an entrepreneur. I think that comes from my family. Everyone in my family has their own business. So I felt that I was like, I think that's what I'm going to do. But then I encountered Dr. Amen and I fell in love with SPEC imaging. He really, mentored me. He showed me a way to look at the brain as an image too. So for me as a photographer, it was like,
putting the two together, right?
Yeah. So that was then, I started working at Amen Clinics and I learned a lot about SPEC imaging, and we're going to talk a little bit about that later. But then the white butterfly came around because I went to Paris on a trip. I like going to, whenever I go to a city, I try to find a museum or something. And obviously, my first time at the Louvre, and I saw this statue of Cupid kissing a girl, right? At that time, I was like, I don't know what that is. Let me, I took a picture of it. I actually have it hung here in my office. And I went home. I started researching about who's that girl. Well, her name is Psyche. And I went down the rabbit hole of like research, and I found that that's where the word psychiatry comes from. So psyche means the soul, and psychiatry means the medical treatment or management of the soul. To me, that was like
mic drop. That's a mic drop moment, right?
Drop. I was like, this is the name of my practice. And she's also known as the white butterfly. So instead of calling it kind of like psyche or because I thought that would be like kind of not too, it would be too obvious. I was like, okay, it's the white butterfly. And I have white butterflies everywhere. Obviously, butterflies have a meaning of restoration, revival, change. So I went down that rabbit hole of research, but then it kind of turned into marketing. And that's where my photography, artistic kind of side jumped in. And I was like, this is it. So yeah.
That is a great story. I mean, one of the things that I love when people are telling their story is it's never really a linear path. Right. So you started off as a fashion photographer. I don't even know. Did you go to college for that? Did you go to some sort of photography? So you had a college degree, but I'm assuming to pivot to med school, it's not like, oh, I'm just applying to med school. You had to do all of the things before you could even get there.
Yeah, I was in undergrad. I had a few degrees. Like I liked the arts, so I did a photography minor, and I did my chemistry major, and then I also did business minor. So I did a little bit of everything, which is kind of like up my alley.
So that sort of fits in, as we were talking previously, just about being a Renaissance man. And I do a lot of everything too, because I have a lot of interests, right? So most people don't know, when I went to college, I majored in Spanish, but I took Spanish, Portuguese, French, like I took all of the languages and majored in psychology as well. So, we are full human beings, besides just what we do. So, and I love that you're an entrepreneur. So tell us about how you're integrating all of these talents and interests that you have to help your patient population.
Well, it was actually coming from a place a few months back where I was uneasy with myself. And I started thinking more, and I'm like, I don't feel that I'm doing what I want to do, even though like I was at Amen Clinics, one of the leading psychiatric clinics in the whole world, really. I was exposed to very, very intelligent people. And I would tell some of my friends, I'm like, I'm, rubbing shoulders with people that have been practicing psychiatry as long as I've been alive, So it's like 20, 30, 40 years of experience in some of these guys where you get a little bit intimidated. But I felt still, being there, that I needed to do a little bit more, and I needed to kind of tap into my creative side. So I started writing a newsletter that went along with my my blog. So one of my patients actually thought the way that it was designed, that it was a magazine. And he told me, "Oh, doctor, I love your magazine. It's so cool." And I'm like, "Well, that's not a magazine." And then from there, I was like, "Oh, wait, I need to do a magazine." So I launched a magazine. And then that's where kind of like the fluid juices, whatever you want to call it, creativity kind of started pumping. And to answer your question, it has allowed me now to start putting all these things in place to help my patients at another level that I think I was not doing before. So the magazine was born. From the magazine, I started getting a little bit more creative again. And I'm like, well, how can the themes of the magazine are actually different qualities. Every month is a different quality that I think we're all struggling to enhance, one of them being integrity. So it was actually during the month of integrity that I realized that I was not at that moment aligned with who I am and my different things that I like. So I started putting together retreats, wellness retreats. So to answer your question, I've been able to kind of marry the two, the creative side, but then also the science side, to put together more things for my patients, but honestly for anybody who wants to join. I think our mental health care space is stuck.
Yes.
I think we have so much incredible knowledge, but I think we're stuck. And when I say stuck, I mean, I think a lot of us are not tapping into that creativity and that curiosity of how can I use this in a different way to heal? Because so far, the last 100 years or more, we're not doing it right yet. And then you look at numbers of suicide, you look at numbers of people who are more and more depressed and anxious, and it's going up. So it's like, okay, we need to stop and reassess.
We need to reset. So wait, so like going back to the magazine for a second, because I have 5,000 questions just in my head right now. The magazine, like, can someone go into Barnes and Noble and get this magazine, or can we
Not
get the
right
magazine
now.
through you?
No, right now we have it as an e-magazine. It's on
Mhm.
my website, but very soon I'm going to kind of do my own, its own thing.
Of course
Because
you
now I'm
are. I
getting,
love it.
well, because now I'm getting a lot of people that want to contribute. At first, I was doing them myself, and some of the articles I was having someone write them and help me put it together. All the layout and design, I was doing that. But now, since it's getting a little bit of a buzz with some people, I'm getting a lot of therapists, nurse practitioners, holistic practitioners want to contribute, which is great.
Mhm.
I now have a really good friend of mine, Ana Lorena. She's a Spanish actress. She just messaged me last night. She's like, "Oh, I want to contribute an article," and I'm like, "Yeah, let's do it." So that's happening, which is kind of cool. But
One of the things I have to show you though is
yeah,
I got from the Holocaust Museum, I think it was either in New York or DC,
uh-huh.
many, many years ago. I got a magnetic board and it said on it, "What do you stand for?" And there were about maybe 20 or 30 magnets, and every magnet has a different core value: integrity, honesty, justice. And I use it in therapy all
Love
the
that. Yeah.
time, for people to find that internal motivation. I'll have to show it to you because it's
Yes,
amazing.
you
But
do.
you were saying
Because
something
that
else.
that goes exactly with, I think, I think we, and this could be, I'm not sure, but this could be where we need to get unstuck from how we're healing, right? I think we're focusing so much on the pathology and we're learning it, and even us as clinicians, we like, we get a patient in front of us, and the minute we see them, it's like, how's your depression, how's your anxiety? So we're still focused on the pathology, and the person gets to a point where they're actually doing really great. But then it's like, now what? We just leave them there. I'll be honest with you. I think we do that. We leave them there until they have another pathology or symptom pop up. And it's like, no, 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 hold on. I think we're missing a little bit of focusing on how can we help this person now grow and not just be focused so much on the pathology.
So one of the words you used when we were talking, before the show was elevate. So it's
Yeah.
not just getting someone to a
Hmm.
plateau,
Right.
it's being able to get them to the next level. And I think everyone is capable of getting to
I
a
think so
next
too.
level.
I think so too. And I think we need to be those people to guide them, to guide all of us. And I think the other thing that might be missing is that since we're seeing only the pathology, then we think that no one or most people don't need to see a therapist or most people don't need to see a psychiatrist because they're doing good. And it's like, well, no, because let's help you elevate. Let's help you optimize your brain. When we look at SPECT scans, you can see brain function. You can see what the brain is doing. Well, why don't we help it not just get out of the pathology hole, but like have it grow, have it elevate, have it be younger? And that's something that
Mhm.
I really learned from Dr. Amen, and he kind of fueled that in me. But I'm trying to see how I can do it with the creative edge that I think I have, and trying to bring as many people as possible to join me on this force.
So tell us a little bit about the SPEC scans.
Yes. So
For the average layperson who would want to know what's the benefit of this to me, why would they want to do it?
So a SPECT scan, it's a little different than an MRI or a CT. I think people think of just brain imaging being all the same, and it's not. A SPECT scan looks at blood flow. So if we look at blood flow, we can see what parts of the brain are maybe overactive or working too hard because there's a lot of blood flow going to it. So when we scan the person, we actually see two views of their brain. We see what we call their thinking brain, which is kind of like the surface, the cortex. And when you think of thinking brain, think of like things like focus, concentration, all that stuff. And then the other part of the brain that we see is the emotional scan, which is the deeper stuff inside the brain, which is kind of, the meat for a lot of the therapy work that people do with their clients. So like when you see on a SPECT scan a lot of activity in a certain part, then me as a psychiatrist can say, hey, this is the part of your brain that is overworked. This is why you're anxious. But then you start seeing patterns of things that are lighting up in a certain way. So that actually defines where you can start treatment. It kills I don't like to use this word because a lot of people do the guessing game, because I don't think psychiatrists are guessing. I think we went through school, we went through training. We're not guessing here, but there's still a lot of variations of, let's say, medications, supplements, even therapies that you have to kind of try to see if it works for the person. Well, what the SPECT scan does, it kind of gets rid of all that time and I go straight to it.
So let's say you have a scan for someone, right? And they look at it and they're like, this is great. I'm going to hang it on my refrigerator or whatever they want to do with it. What do we do now? Is it now you target the therapies, you target the medication, you do biofeedback? Like what comes next?
Well, from there, we put together a treatment plan of all of those things depending on what the patterns are showing us. So one of my favorite patterns is what they call the diamond pattern. And it's three parts of the brain that are lighting up, creating in the shape of a pattern. Well, of a diamond pattern. We see that in people who've experienced emotional and psychological trauma. So immediately, I'm going to go to trauma-focused therapies. I'm not going to do any other kind of therapy because it's like, okay, hey, this is really lit up this way. We just need to jump into that. So I've had patients who struggle at the beginning to kind of figure out, do I want to go into the trauma work? Some people are afraid to do it because they're kind of revisiting those memories, but that's where the healing can actually start taking place.
Do you have a trauma therapy that's your favorite? EMDR? Like do you have one that you happen to like because you think it gives good
EMDR
results?
has been one of my really go-tos. Even when someone's telling me like, well, I don't remember any traumas, I don't think I have anything, so I don't know what you're talking about. When I see it on the scan, I still tell them do that therapy because there's a part of their brain that is lit up usually. It's called the occipital lobe, and that processes everything that is like visual memories. Something like visual kind of therapies like EMDR are perfect. So even if the person doesn't remember any traumatic events or anything, the EMDR really kind of unlocks that. And it's incredible because they'll come back 4 sessions later and they're like, wow, you were right. We tapped into a memory that I didn't, I kind of suppressed or I blocked it. And this really did it within 4 sessions. So that's actually one of my favorites.
So people are looking for a quick fix, but a lot of times it's not.
It's not.
And it may not be one therapy. You may have to put a lot of tools in your toolbox. So, for people who are complicated, and listen, for people, I hear this all the time, people who may say, especially high achievers, who don't want to use medication because they have this idea of, I want to do it on my own. How do you answer? I get that question at least once a week when I talk to someone about a referral for medication. How do you explain it to someone as it not being a personal flaw, but just being something with your brain that we can target? Like that's what we've been working towards.
The way that I explain to my clients is like, well, your brain is an organ like any other organ. The only major difference is that this organ thinks, behaves, makes decisions. So if it's damaged, you will not be making good decisions. You will not be making, uh, you know, rational thought processes, because that's how this organ works. So it's different than a heart. A heart is just going to pump blood. Like one of my favorites is when they tell me, "Oh, I feel it here," and no, you feel it here. There's no
Right,
such
right.
thing. That's that romanticism of the heart. The heart is just a pump. It's just pumping blood. That's it. Your emotions, your feelings are all up here. So if this is hurt, and it could be physically, it could be mold that sometimes we see on a scan, and they never even knew that they have mold. Any kind of inflammatory issue that you can see it on the scan, toxins, it can alter that. So someone that comes and says, "Hey, I think I'm going to do it on my own. I don't need anything, yada, yada, yada." And I tell them that's your frontal lobe talking, and your frontal lobe is damaged. So our frontal lobe
Oh,
makes decisions. Our
that's
frontal
good.
lobe makes us be driven and self-sufficient, or at least the belief of being self-sufficient. So I'm like, that's your frontal lobe, and look at it. It's damaged.
Hmm.
So that becomes more like tangible, more real for the person to see what their brain is doing.
Gotcha.
And then they start connecting the dots more.
Hmm. So I have another question about that because I'm getting really excited listening to the science here. I'm like fidgeting in my chair. But let's take a break, and then we'll come back after a moment from our sponsor, and we'll go into the question. Okay, so here's the question that I have for you. Talking about all of this brain stuff, you said something which is a personal interest of mine that I research. This whole concept of inflammation. And I do a lot of work with people who have autoimmune disorders. And I often tell them, when they feel depressed or foggy or anxious, and I say to them, look, science has done us wrong. The medical field has done us wrong. No disrespect
No,
to
I
you as
get
a
you.
doctor,
I get you.
but they forget that, listen, if your body is inflamed, don't you think your brain is inflamed too? And so you just said the thing that I have to know about. How would you know on a SPEC scan if a brain is inflamed? Is it by lack of blood flow, too much blood flow? What are you seeing?
You see it in both scans. In the one that is the surface, you see lack of blood flow everywhere. So it looks like scalloping is what we call it. So it's like really bumpy. So you're like, okay, there's a toxin here. It could be a toxin like a drug, or just flat out inflammation. Then we got to dive into it to diagnose it and treat it. But then on the emotional scan, you see a bunch of specks everywhere, like little red specks everywhere. That's increased activity in the emotional brain that also tells us a sign of inflammation.
And so the way that you work with people is it may be medication, it may be EMDR, it may be supplements. Tell us about your view on supplements. I love them. I take
So
tons of them.
supplements, I'll be honest with you, at the beginning, I was like, nah, this is all garbage. This is all money making. I had to study because we're not taught that in our Eastern world kind of medicine. We're not taught that. So I learned a big chunk of them. There's some that there still needs more research, more because sometimes it's the dosing that needs to be much higher. One of my favorites is GABA. I use it a lot, but it needs to be high dosages. If not, it's not absorbed by your brain. So like they're very, very effective. I use them quite a bit. If not, probably 70% of my patients, that's all they're doing. The other ones have a combination of both. Hardly I have anyone just on meds. And usually those people are people who they want that just one fix.
Mm-hmm.
And that's a little small group of my population that are not improving.
Mm-hmm.
I tell them you got to do it all. You can't just do one thing. So they just want a pill to fix the whole thing.
Right. What do you think of NAD plus?
I think it's really good. I think
Mm-hmm.
it needs more time
Mm-hmm.
because we don't, we also have to think about, you know, and pot is one of them. And I'm not comparing the two. I'm just saying an example of when something becomes available in the market, a lot of people run to use it because of the benefits, but you might not get, issues from that thing that we're starting 20, 30 years later.
Mm-hmm.
So I think there needs to be more of that time frame. And this is what I tell my patients. I don't want to be a guinea pig of that 20, 30 year period because I don't want to 20, 30 years from now have something show up.
Right.
And I think right now with the increased inflammation and the increase in autism, for example, something we started to consume, all of us, years ago, then now we're seeing that wave.
So I'm so glad you said that. I'm so glad you said
Yeah,
that it isn't like something that you may be happening right now.
right
This is
now.
something
Yeah.
that has gone on that may still be in our bodies.
Mm-hmm.
Yes,
So
absolutely. I love
I
it.
still believe it has great benefits, but I think a lot of these things we got to give it more time to see what is going to show up later.
Hmm.
That's always my concern.
Yeah.
A little bit
Yeah.
skeptic when it comes to some of these things.
So tell me a little bit about your concept of collaboration. I mean, you are obviously interested in working with therapists, photographers, like whoever, like you got it all
I
going on.
I learned that from being a photographer. And I think we talked about this earlier. Like, I put together a photo shoot that would take months to prepare for. It was a 1 day or a 1 week experience, but leading up to it was multiple meetings with different people, the art director, the whoever the client was, the stylist, the makeup artist, the hair person, me as a photographer, the post production. So we would meet periodically. So I learned that collaboration vibe or spirit, whatever, from being a photographer. So when I became a doctor, I saw that that's not real. Like people say it, like, oh, we collaborate with so and so, and then I actually go and I see what the collaboration is. It's not at least to that extent that I did when I was a photographer. And my view of it is, well, if I spend all those weeks meeting ahead of time to produce a photo, which nothing against the artists, right, and the artistic world and even advertising world, but we're here healing people. Why are we not spending that amount of time, if not more, to literally work together? So what I always try to do is I do meetings with therapists and anyone, psychiatrists. I work with people from pretty much everywhere. I consult patients from other parts of the world, and I put together the team. I'm like, I'm not going to see this client until your psychiatrist, your therapist, your neurosurgeon, whoever is going to
Everyone.
join us. If not, we're not going to succeed. And I
Hmm.
have seen it all the time. The
Yeah, because
clinicians that are like,
collaboration. I'm
yeah,
sorry, go ahead.
no, the clinicians that don't participate, the patients just take longer to
To get better.
improve,
Yeah.
Because I would tell them, like, something that's going to take you 10 minutes to talk to me can help this person for the next year. Like, it's quick meeting. Most people are more open to it, especially that I tell them that this is what I mean by collaboration, like actually talking.
Yes. Yes. Yes.
you know?
Collaboration is not just cross referrals. It
No.
means you're actually sitting down, doing almost like a mini grand rounds on each
Yeah.
particular patient, right? And
Mm-hmm.
that's what you can do when you're in a concierge setting. It's so hard with our healthcare system being
Yeah.
the way it is right now if you're insurance based. And people will often ask, like me, and I'm sure they ask you too, why don't you take insurance? This is the exact reason why I don't take insurance, right? Because insurance is keeping you from getting well. And of course, I just use my insurance to have surgery, so they'll probably cut me off now and say, "Do it on your own." But yes, insurance has a place for some parts of the healthcare system, but we've let insurance companies run the show
Yeah.
instead of the
Instead
professionals.
of the professional. And I think in some things like surgery, something that is procedural, fine. I'm not against that. But I think when it comes to mental health, they're trying to put us in the same box as these other clinicians, and we're not. And I'm very proud to say that we're not. For a long time, I was like, no, I'm a doctor too. No, I know I'm a doctor. But how we treat and how we actually do our care is not the same as a surgical procedure. This is not like check, 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 check. This person has this. Okay, give them this. Everyone's going to
And
get this.
isn't that what's so cool about our field? Because
I
that's where the
know.
creativity
Mm-hmm.
comes in, where, I mean, obviously you're a very creative person and I'm creative in a different way, but I like to try new things and think outside the box. And it's like, if this hasn't worked for this person, this evidence-based treatment that's supposed to work in 8 sessions, we're going to try something else, even if it seems a little bit like, why would you do that? well, I'm doing it because nothing else has worked. And I think this could actually do something.
Mm-hmm. And I think that's also what led to this huge demand from clients going towards supplements, for example. I think why supplements are growing right now is because people are like, I'm taking this SSRI, it's supposed to work, I'm not feeling anything. But then I'm taking this supplement, 5-HTP, wait, hold on, I'm feeling a little, there's something that is doing.
Right. And maybe without the side effects, the sexual side effects,
All
the
that
dry
stuff.
mouth, the
So
things
it's
that
like,
turn people off.
why can't we do things in a different way? And that's where I want to encourage, not just insurance companies, but a lot of these people that are making these I guess the rules. You have to be thinking differently, and you do have to have a little bit of creativity, and not to obviously at all ignore the research based medicine, of course. But we are already doing that, so it's not like I'm not saying discard all that. No, no, no. We are doing that, but it's not working for this individual in front of me.
Right.
Now
So
what?
try
What do I
something.
tell this
Right.
mom, that their kid is not improving and they're still aggressive? Well, I have to open
Absolutely.
my books and look at the pharmacology of other medications that are not used for that and say, this is really, I think is going to work, or this supplement is going to work because of how it works on the brain.
Fascinating, fascinating stuff. So where can people find you? Are you taking patients? What's going on in your world in the future? Like, I just feel like you're exploding. So tell us all about that.
Well, right now, so yeah, I am taking patients, new clients, but I'm also doing retreats. So I'm going to be doing wellness retreats pretty much everywhere. Right now, we're doing in Cancun our first one that I'm doing on my own, because a lot of these we're doing with another therapist who's amazing. Is the 4th of July weekend. We're going to Zion National Park. And that's going to be, I think, really beautiful. And I'm very excited about that one. That one, the theme of it is called Coming Home. And a lot of it stems from the journal that I'm putting together for the one for integrity, which I believe integrity is aligning ourselves with who we are and coming home. So that's kind of opening up all the retreats for the rest of the year. We have other ones coming up in Colombia, in Medellin. We might do a couple in Puerto Rico, in Rio for sure, in Sao Paulo. Have a big group of therapists in Sao Paulo that they want to do these with me. So we're right now curating and putting them together, so it looks beautiful, but also designed, because that's the part that I like visually, how it looks. I think it's important. So we're doing that, and on my website drhector.com, I also have a lot of resources on there, therapists, other providers that the person might be in need for, and I'm trying to put together kind of like a place where people can go and find coaches, find therapists all in one. Trying to work together with other websites that kind of have that same idea. So these are some of the things that I'm working on.
I love it. I love it. Okay, so final question, is there a place for you, whether it's in the US or internationally, that when you go there you feel like you're coming home?
This my home, honestly, my home. My puppies, I have 7 dogs. My partner and like everyone around me. I have great love from
So you
everyone, and
curated that.
I
You
you
curated
have
that.
to, and you also have to maintain it.
Mhm.
So we have new people. I have new people in my life this year, very close, and they're very special. So you kind of still have to harvest that. You gotta still water it, take care of it, remove the roots. I that's a visual that I tell my patients is that you're taking care of your garden.
Mhm.
And when you see someone that comes at you and tries to run through your garden or stomp through it, you have to stop them and get them away. And it's really quickly for us to see that. So I would really say that I've been taking care of my garden for a while now. And I think things are lining up beautifully. And now when you start seeing some of the blooms showing up, which is kind of magical, but then that's when
Mhm.
I get more protective,
Yes.
of my
Yes.
garden.
Absolutely. I may have to ask you for some advice because every plant in my garden always dies. I don't know what I
Oh
do to
no.
I have a brown thumb, so just
Oh,
using that metaphor, it's funny.
I love plants.
Uh-huh. Uh-huh.
And it's
That's
therapeutic for
beautiful.
me. I'll be honest with you.
Beautiful, beautiful. Thank you so much, Dr. Hector, for joining me today. It has been a true pleasure to have this collaboration. I'm sure it's not going to end here. I love hearing everything that you're doing. And thank you so much for sharing your knowledge and wisdom with us today.
Anytime. Thank you so much for having me. I love this.
Have a great day. And don't forget to check out the next episode of From Mayhem to Mindset with Dr. Laura. Thanks for joining us on From Mayhem to Mindset. If you found today's episode helpful, be sure to subscribe wherever you get your podcasts and leave a 5-star review. It really helps spread the message. Want to dive deeper? Check out my book, Wisdom from the Universe, available now on Amazon. And if you're looking for a speaker to inspire and transform, I'd love to connect. Visit www.lauraellick.com to learn more. Remember, you don't have to just survive, you can thrive. See you next time.